Hi, I'm Kirsten Eagles. My student number is T00698082. Today I'm going to be doing ear and eye exams. So I have Grover here along with Dr. Nicole Mann and Allie Harris. So I'm going to be doing an ear exam on Grover to start. So first we'll check his hearing. So we'll check hearing in both ears. So we'll just kind of see if he can see where the sounds are coming from, which he does. Everything's great there. And then external, looking at the ears, everything looks great. You're looking for signs of like redness or any sort of discharge coming out of the ear, anything like that. And then we'll use the otoscope to look inside the ear. So with the ears, you do have to do a lot of moving around because again, they have that L-shaped ear. So you can look in, and then if you look down, you can see. So you want to try and visualize the tympanic membrane. You're looking for any redness within the ear or any buildup, anything like that. All right, so next we'll look into the other ear. Down in, and everything looks good in there. Nothing. So you can see the tympanic membrane. It's actually like a little white disc within the ear. Okay, so next we're just going to do some ear cleaning. So Grover's ears are actually pretty clean, but we'll just kind of clean them up just a little bit. So you'll put just a tiny amount into the ear. And then squeeze the base of the ear, kind of rub it around. You can pull on the pin just slightly to help the drops get down. And then you'll wipe out any sort of excess that's in there. There. And then you can let them shake if they need to. He's pretty good. All right. So he doesn't actually need any medications as of right now, but I'll just do a demonstration of what you would do if he does need medications. So I just have some ear cleaner drawn up in a syringe here. So you would just draw up the prescribed amount and then just squeeze that right into the ear canal and let it do its thing. All right, so next we'll do the other ear. Do the same thing, just a small amount in there. There you go, rub it around. And we'll just wipe out any excess. There, there we go. And then we would do the same thing for the other side if the other ear needed medication as well. All right, so I have Allie here again, and I've got Briscoe, and we are going to be taking a look at Briscoe's ears. So again, Briscoe is one of our clinic cats. He hasn't had too many issues with his ears. We're just going to check them out, see how everything looks in there. So first, we'll try his hearing. So, here you go. We just want to make sure that he responds to any sounds. Perfect. So looking at the outside of his ears, we want to just check for any, again, redness, any sort of debris on the outside of the ear, discharge, anything like that. Both ears themselves look great on the outside. So we'll take a look on the inside. Right, I know, babe. Okay, so again, where the external auditory canal is like an L, we gotta kind of go down and up. All right, so I'm just checking inside, making sure everything looks good. So you can actually visualize the tympanic membrane. Again, that white circle, just want to make sure that that looks all good. Make sure there's no debris blocking the ear canal or anything like that. We'll check the other side. All right, boy, I know. You're doing great, and everything looks fantastic in there as well. Perfect. Okay, so lastly, we're gonna do some cleaning for Briscoe's ears. So we're just gonna use some Odie scrub. His ears aren't too bad, but we'll clean them up a little bit. So we're just gonna put a small amount right in the ear. Scrub that around a little bit. And then we'll clean out the excess. I know it may be itchy. There you go. And he doesn't actually need any medication in his ears, but we'll do as if we are. So you would drop the prescribed amount, and then you would just squirt that into the ear canal, just like that. Perfect. Do the other side. All right, buddy. So just a little drop. Scrub that around. And we'll wipe all that stuff out. Perfect. And then doing the same for the other side as if we were doing medication. Just a small amount right into the ear canal. There we are. That is everything for Briscoe's ears. All right, so next I have Briscoe here. I also still have Dr. Mann, and I have Allie. So Briscoe is one of our clinic cats. So he does have some history of eye issues that he's currently receiving some treatments for. So we're going to be checking him out today. So first we're going to check some of his reflexes. So we're going to check the Manus response. So we'll check that for both eyes. So we'll cover one eye, and then we'll kind of come at him, and we just want to make sure that he blinks. And then we'll do it with the other eye here. I know. And he's blinking there. Perfect. So next we are going to check the palpebral response. So that is his blink response. I know. So we're going to tap right in here and just make sure that he blinks, and then we'll do it on the outside as well. And then we'll do it with the other eye. He's blinking, and he's blinking there. Okay, so now we're just going to check out the actual structures of the eye just to make sure everything's looking okay. So we'll be looking at like the pupil. We'll be looking at the cornea itself to see if there's any actual visual damage to the eye or anything like that. Checking out his third eyelids and his conjunctiva, just to make sure nothing's out of the ordinary. Okay, so we are going to check his pupillary response. So I have the light here. So basically we're going to be checking direct and indirect. So direct will be when his pupil shrinks when I shine the light on it, and indirect will be when the opposite pupil shrinks as well when I shine the light on it. So we'll check that. See that his pupil is shrinking. And it's doing the same on the other side. There. There. And again, just checking that he's got bilateral dilation and shrinking in each eye. Okay, so now we are going to visualize the retina. So we'll be using this book here as well. So we'll check this eye here, so you can actually see it glowing back there. So we're just making sure that everything looks healthy. And we'll check the other eye. And everything looks great there. All right, so next we are going to do the Schirmer tear test. So this is a way to test tear production. So we'll get started here.
I know, buddy.
We'll fold this. This is going to go, so they are labeled left and right, so this one's going to go in the right eye. I know. So you're going to peel back the eyelid and tuck that right in there, and then you're just going to try and stabilize the eye. And then you're going to wait 60 seconds to see how much tear production is made in that minute. All right, so after 60 seconds, he'll remove that. And then so we can see here that his left eye really doesn't have a whole lot of tear production. So next we will do the right eye. So you will do the same thing in that corner. I know.
You're doing so good, handsome. I know, buddy. I know. Good boy, Chris. Good, handsome.
And then we'll hold that and then wait another 60 seconds. Okay, so now we are going to do the fluorescein stain test. So what that test does is it tells us if there's any damage to the cornea itself. So if there's damage to that tissue, the stain is going to uptake or stick to that damaged tissue. One thing as well is after having this done, sometimes clients will notice that their animal has green discharge coming out of their nose. So basically what's happening is that that stain is getting taken in by the lacrimal puncta, or the tear duct, and it's traveling down the nasolacrimal duct and actually coming out of the nose. So you should always make sure to let them know not to worry that that's happening, because it is normal. All right, so we'll start with the stain. So basically we're just going to do, I'll actually get this ready just so we don't make a mess. So just a drop right into the eye.
It's okay, buddy.
There.
Feeling so good, handsome.
And then we'll use the blue light on the scope here and check for any uptake. So we can see not much there. All right, and then we'll do the other eye. I know.
Oh,
Yeah, I know. We'll just clean up any excess. And then we'll check that eye. And see no uptake on the cornea itself. And then we're just gonna flush that out, just so it's a little more comfortable. Yeah, I know. Here, clean you up.
I know, handsome.
There. All right. So next we are going to do tonometry. So this is going to measure the pressures within the eye. So we have our tono pen here. So we're going to start with the right eye here. So we'll do it 6 times. Perfect. All right. And then we would switch to the left eye. So we'll switch out our probe there. There we go. All right, and then we will do the other eye.
I know.
Good boy.
I know, it's fine. It's okay.
Perfect.
Good boy.
Nice. Okay, so lastly, we are going to be putting some medication into Briscoe's eye. So this is actually one that he's on right now. So we'll be putting a little bit into his eyes.
I know.
All right, so you just want to come from the top. Make sure not to touch the eyeball. And just put it right along the bottom lid there. There. All right, we'll do the other eye as well. I know, buddy. There. Good boy. Perfect. So that's everything for Briscoe's eyes.